A sea of adults and children awaits the group of volunteers at every mission trip they make, like this one, to Cambodia in February of 2018. These people don't have the luxury of visiting a doctor's office when they're sick. They must wait for the medical experts to come to their rural, isolated, and secluded area of the world.
I've been doing this since 1986. It was the first trip to Honduras.
It began with a promise of one trip to rural Honduras for Dr. Stoney Abercrombie, the MUSC ANMED Health campus dean for third and fourth year clinical training in Anderson. That promise was forever broken on his last day in Honduras when he was unable to save a dying child.
I swore to myself that I would go back and I would get more support and come back.
And come back he did. Dr. Abercrombie founded Volunteers in Medical Missions, aimed at curbing disease and death by providing much-needed medical care and medicines to desperately underserved remote areas of the world. VIMM is faith-based with Christianity at its core. Dr. Abercrombie's Christian convictions are reinforced as he thinks back to a trip 20 years ago to Tanzania, East Africa, when a woman bleeding to death from a ruptured ectopic pregnancy defied the odds.
We were getting ready to leave, and all of a sudden, the crowd gets really, really loud, and I'm thinking, okay, they're going to riot. They're gonna eat us. They're gonna take us, kill us, or what? Because we're leaving. And it got deathly quiet. And I looked out, and the crowd just parted. And there she came, walking down in the middle of those. No fever, no pain, completely healed. I am totally convinced that was nothing to do with our medication, but with a higher power. That kind of things are the things that keep stimulating me to want to go back.
Dr. Abercrombie says he goes back because it's his way of paying back society for his many blessings.
I think it makes me a better doctor, and I think it makes me a better person.
He encourages residents in his program to go on the missions to help them become more culturally sensitive and compassionate. Dr. Ashley Major, a second-year family medicine resident at ANMED Health, went on the Cambodian mission in February.
Seeing these people specifically and how grateful they were just for the smallest things. I mean, we had a limited formulary that we were working with as far as the medicines were concerned, and people had the same complaints there that they do here.
Dr. Chris Bales, a third-year resident at ANMED Health, also went on the Cambodian mission.
It's made me compassionate for people who don't have access to the medical care like we do.
When the volunteers walk into a camp or clinic, major and minor medical ailments await, from needing pain medicine or glasses to stitching up a little girl's foot torn apart by a bicycle wheel. Volunteers in Medical Missions is based in Seneca, South Carolina. Its reach is global, and care offered by the ANMED Health volunteers who take their training, skills, and compassion beyond the borders is priceless. For ANMED Health, I'm Liz Walker.